The BGCS is trying to get unit leads more involved in cancer society, and one of the things they've done is set up a session for the unit leads in the annual scientific meeting. So we did that in Glasgow and it seemed to be quite successful, and they've done it again in London, and I was pleased to say that the room was standing room only again, so it went well, and I think the talks in the session are very good. Okay. I presented the results of a survey which was done to the unit leads in the country. So 38 people answered, so it's quite a good response. There's not that many unit leads, but although there are quite a few people involved in the cancer diagnostic service, but the unit leads are the ones responsible for liaising with the central cancer multidisciplinary teams and for managing low-grade and low-risk endometrial cancers. One of the things that came out of the survey was that most unit leads feel that they don't have enough resources to do their job, feel it like a bit more training, and they're concerned about the lack of cover for their services, for instance nurse cover and for cover for themselves when they're away. Really it's important that's sorted out, because the government cancer targets are changing, so the time to diagnose and treat a cancer is going to halve within the next couple of years, and with the current climate we really need to find a way to make sure that the unit leads are well tasked to do their jobs. The main thing that they had was that they feel that their local hospitals aren't supporting as much as they would like, and they would like the British Gynae Cancer Society to give them support and perhaps some guidance. And I think they'd like some more education for the unit leads, and also possibly some more training. And I know the British Gynae Cancer Society is looking at doing that in the future, and it's just how the best way to deliver that. Really the focus of the government is about cancer diagnosis, so you get an early diagnosis of cancer. So it's really important that the unit leads and their colleagues who work in the diagnostic facilities are able to do their job properly. I mean, for instance, there isn't any real standard as to what should go on in a diagnostic clinic in gynecology, and I would hope that British Gynae Cancer Society and NHS England would look at that in the future, because it would help the unit leads in their discussions with local managers. And the unit lead sort of advisor for the commissioning services for NHS England. And really, although they're focusing on the design of services, really they wanted to know from the unit lead's point of view, would this work? You know, and I'd get my chance to put my little say in. And I'm also contributed a little bit to the working groups on guidelines. But from my point of view, I'm involved in training. We do, in the northeast of England, we do cadaveric training for the registrars as part of a gynecological surgical training, which is well received and very popular. And I'm one of the senior faculty members there. And I'm involved in the National Colposcopy training as part of a certification and training committee nationally. So all oncology related and all relevant to diagnostics. As a unit, there's a couple of trials we're recruiting to, which to do with ovarian cysts, these are the sort of things that the unit leads need to do, recruiting as much as possible when they get the chance to the National Institute of Health research trials, and hopefully the BGCS can come up with some more trials which are relevant to units as well.